Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt, your live streaming host, and with us today on a nice sunny Friday afternoon in Florida, Dr. Thomas Payne of Atlantic Coast Aesthetics. Tom, how you been doing lately?
Not bad, not bad. Usual stuff.
All
What
right.
else?
Well, we have some pretty good questions today, and one is, and we get this quite a bit, is if I have pre-existing conditions, medical conditions, will that affect my ability to get plastic surgery? And it's a common question. And Tom, how do you address that? And what's your viewpoint?
Well, it's a great question, and it's one of the areas that we've sort of de facto specialized in is taking on patients that might have not a perfect medical background. So, like we could list off some of the conditions I've just in the last couple of years that we've handled routinely. Patients with a history of sarcoid, diabetes, HIV, previous heart surgeries, um, patients with a history of having had blood clots in the leg, even sometimes pulmonary emboli. Um, the way we approach it is we always want to set things up for success. I mean, if you look at we'll make a sports analogy. Um, people that play billiards or like golfers, right? They set their situation up best they can, and then when they do these things, they make it look like it's easy. Obviously, they don't want to hit the ball out of the rough or something like that. But when they set up their shots and prepare so that they're making a good shot, and then the next shot's easier, and the next shot's easier. That's the difference between them and everyone else. That's we're whacking away in the weeds there. We kind of do the same thing with these medical cases. I don't like to turn people down routinely over the phone because, in my thought, as trying to be an ambassador for our specialty, somebody runs off to maybe somebody that's not the greatest that might do the case, not knowing what they're getting into, or they run to a foreign country where they'll do anything, and something bad happens to them. Then it reflects bad on all of us. Plus, the person had an untoward outcome, which we don't want. So the key is to look at each one of these cases for their details. Let's take an example, like somebody with diabetes. We know how well the diabetes can be controlled. When it's controlled well, the risk is low. The other thing is the type of surgery being sought affects the risk profile. Certain operations are very low risk by their nature. So let eyelid surgery, upper, lower eyelids, that kind of thing. Lumps and bumps, moles, lipomas, things like that. They're not high risk surgeries. A lot of times they can be done under straight local anesthesia or with a little light sedation. So let's say somebody has a history of blood clots in the legs. Okay, well, that could be for a lot of different things. There are cases where that can be maybe it was years ago, maybe they smoked cigarettes at the time, maybe they were heavier at the time, maybe they were on birth control pills or hormones, at the time. All those things increase the risk. So maybe they got a blood clot in the leg. It was self-limited. Nothing really happened. They were on medicines for a while. Hematologist worked them up. They have no clotting disorder. A lot of offices will just rule them right out on the phone. I want to know more because it's possible that that's actually very low risk. And they may not even be on blood thinners anymore. You talk to their doctor and it's not a big issue. And if that person's coming in for eyelid surgery or something like that, there's essentially no risk over the baseline. I'll do that person usually with no problem. Sometimes people are on ongoing blood thinners, but it's not so bad. And their doctor is fine with it being stopped for a couple of days. Okay, I usually talk to the doctor. We figure out how we're going to run the anticoagulation, and then we do the procedure. I'm trying to think if I've had one of these patients with a problem background not have a good outcome. I actually can't think of one because, like I said, we set it up so that we don't really have those issues. And it's different. Let's say somebody comes in, they had pulmonary emboli in the past. That's more serious. And they need to have their blood thinners. And their doctor is comfortable for stopping it only for a short time. Well, again, if they're having minor surgeries, the risk is lower. But if they come in, they want to say a mommy makeover, breast, tummy with implants, and it's longer surgery. That might have to be broken up into two surgeries. So again, we'll approach it on a case by case basis when we look at what their background is. Another good example is somebody had heart surgery as a child, yet they're not on any medicines today, and they're completely cleared by a heart doctor. No issue. A lot of times they'll get turned down. But depending on what that surgery was as a child, many, like I said, in the case I'm going to make up, no medicines at all required. So for me, there's really no baseline difference. What I usually do is I talk to my anesthesia personnel and the facility and make sure that we pick the right place for the surgery. So the three places we do the surgeries: office-based, ambulatory surgery centers, the next step up, and then a hospital is the highest step. The costs tend to go up a little bit as you move up those steps, but if we can keep you at one of the lower tiers, not hospital, but ambulatory surgery center or office-based, it's going to be more affordable. But it depends on what the condition is. Certain conditions would be rated as what they call an ASA 3, and then you're not allowed to do it in the office. So then we would do it at the ambulatory surgery center. Slight increase in cost, but not tremendous, and usually they have no problems handling that. And again, the key is we don't just take on the case without any background. I'm happy to go over the full, we have a full medical intake when people approach the practice. Then I ask further questions, get the notes from their doctors. We also get some labs. And then, like I said, I'll get on the phone and speak to them and say, hey, what's going on here? And I'm trying to think, when we've taken those steps, even if we have to go to the level of the hospital, I don't think we've ever had to turn anyone down. But we might have to break up a case. It might be that somebody wants breast tummy tuck with a lot of lipo and things, and they do have an issue where they have blood thinners that can't be stopped for a long time. That one we might do in 2 stages, just to be on the safe side. But most of the time we can handle it through what we do. And that's, like I said, people kind of find us for that, and that's great. We don't mind taking a look, because we'd rather have people having good outcomes than have issues showing up in the news. So,
and for people searching for you, just to keep in mind that soon we'll be announcing a new name for Dr. Pane's practice. Right now it's currently Atlantic Coast Aesthetics, but maybe some viewers will have some suggestions. So please send them on in, but we shall reveal that on another show. So Tom, thank you for your time. And would you like to tell everybody how people can find you?
Yeah, you can find us, the practices in Palm Beach Gardens, 561-422-4116, and Instagram at Dr. Thomas Pane is the tag there. And and online, acplasticsurge.com.
Thank you, Dr. Pane.